Shahin Nooreyezdan, and I'm a plastic surgeon here at the Apollo Hospital in New Delhi. Um, I work at the state-of-the-art cosmetic surgery center, which we have here, uh, in which we have a dedicated hair transplant suite. And I shall be talking to you about hair transplants. There are a few questions which have been sent across to us. And the first question is from Nitin. Nitin says, can there be hair loss after a transplant? Uh, the hairs that we transplant come from the back of your head and they are designed never to fall. So once they're transplanted to the front of your head, which is the area of male pattern baldness, those hairs never fall. Yes, of course, you can lose the remaining hairs on your head, the non-transplanted hairs, but and that may require subsequent transplant, maybe 10 years or 15 years down the line. But the hairs that we do transplant will never fall. The second question is, can a FUE hair transplant fail after a successful procedure? This is sent by Anush. Now, failure is not an option when we talk about cosmetic surgery procedures. These FUE procedures, which are follicular unit extraction procedures, cannot fail. It is not possible. I have not seen that happen, and it cannot fail due to any technical reasons. The next question is, can lifestyle choices cause new hair loss after an FUE transplant? This is sent by Shikha. Shikha, after an FUE hair transplant, the lifestyle choices do not determine the reason for hair fall. Yes, of course, if you're severely malnourished or you spend long periods of time in the sun wearing a helmet or a hat which heats up the scalp, that can contribute a little to hair loss. But hair fall is essentially it's a male pattern baldness, and it's entirely a genetic thing, and it's hormone responsive. So no lifestyle choices cannot cause your hair to fall after an FUE transplant. The next question is from Pranav. He asks, what if I am not a good candidate? Well, if you're not a good candidate, I'm sorry, Pranav, then we really can't help you. You can try one of these other procedures which are available in salons, things like hair weaving and wigs and a patch of sorts. But if you don't have enough donor area for us to pick up the follicular units from, then as cosmetic surgeons, we can be of no use to you. Jaspreet asks, is FUE transplant painful? Not at all. This procedure is done entirely under local anesthesia. We use some local anesthetic cream for about an hour before we put the injections to numb the scalp. You feel a little discomfort, you feel a little bit of stretching of the scalp, but there is no pain at all. This I can tell you. And it's done under local anesthesia. We take breaks. You can have a coffee break. You can have a lunch break. You can sit up, and it's not like a surgery where you're anesthetized and you're all groggy and nothing like that. Himanshu asked, is the hair transplant surgery long? Well, typically, to place about 3,000 odd grafts, which is the average number between 2,500 to 3,500. So we say 3,000 grafts. It takes about 4.5 to 5 hours. So yes, it is a long surgery, but the patient is awake, and you can take some breaks if you want, like I mentioned earlier, for coffee and tea. Saurabh asks, will it look natural? Well, that's the idea of a hair transplant. It will certainly look natural. So when we reconstruct the anterior hairline, which we do with hair transplants, we place the hair follicles in a staggered, like a little bit of a zigzag. We don't make an absolute straight line. We stagger it a bit so that it looks natural when the final hair grows. Ankit asks, how long does it take for a hair transplant to heal? Uh, in 48 hours, the dressing comes off. You go home with the dressing on your head, which comes off after 48 hours. And after that, you will wear a surgical cap, much like this one, uh, for about 2 weeks. Everything heals in about 5 or 6 days, and after about 6 days, we allow patients to pour some water on their scalp and gently shampoo it. So it takes about 5 6 days, and you're in the clear. The next question asks is, does the beard transplant and hair transplant have different risks? No, it has nothing of the sort. Uh, the beard transplant, we use the hairs from the beard. Of course, if there is no very little donor area available, the beard is a good site for picking up follicular units. Of course, we are limited by the number. You can't pick up more than 500 or 600 units from the beard without damaging how the beard does look. But there is no risk. There's no risk at all. One of the questions asked is, will people know I've had hair transplant surgery? Uh, yes, the people who know you, who've known you as a bald person, and suddenly see you have a hairline and you have hair in your head, they would know that you've had a hair transplant. But if somebody met you for the first time, he wouldn't be any the wiser. The next question is, when will I see the results? The units that we put, typically they all fall off within about 3 to 4 weeks. The hair shafts, they fall off, but the bulbs remain. And after about 2.5 to 3 months, they start to grow. And you will see the final end result at about 6 months post-procedure. The next question is, how long will a hair transplant last? Well, a hair transplant lasts forever. I mean, the hairs on the back of your head, like I mentioned earlier, they're designed never to fall. So once we transplant them to the front of your head, it's going to be there forever. Of course, you will lose the remaining hairs on your head, but the ones that we transplant don't ever fall. Someone else asked, are there any complications from the surgery? Well, it's a procedure under local anesthesia. I have not seen any complications. I mean, the complications of any surgery are infection and bleeding and blah, blah, but nothing of that happens with a hair transplant. It's a fairly simple, straightforward procedure. Will I be able to swim and enjoy physical activities with my new hair? Of course. 3 or 4 weeks after the transplant, you can get back to your normal activity. And when your new hair grows, you can comb it, brush it, you can blow dry it, you can do whatever you did with your normal hair before it fell out. Another question is, what precautions should I take after the surgery? Well, your precautions will be told to you by us. I mean, we have a little checklist of precautions. We have a dressing on your head for 48 hours. The dressing comes off after 48 hours. You're not allowed to wash it for about 5 or 6 days. After 6 days, we give you instructions on how to wash your scalp. We give you instructions on what shampoos to be used, what products are to be used. But those instructions are tailor-made for the patients, and you will receive them once your operation is done. Do I have to use any specific shampoo or specific hair products after the surgery? Not really. Some people do use, some people don't. The only thing that I advise patients to use is an anti-dandruff shampoo, which is to be used once every 3 or 4 days. Otherwise, you can just be normal. Some people choose to take supplements, and stuff, but I don't think that's entirely necessary.